Hi there everybody, Dr. Mandy here, hopping on to talk about one thing that always comes up in our office on a daily basis, it seems like, is tinnitus. Some of you might even know the term as tinnitus, and some people come in and say tendinitis. Well, tendinitis is inflammation of the elbow, but tinnitus or tinnitus is ringing or buzzing, a subjective sensation in your ear that you might notice when it's quiet, or when maybe you might be talking to somebody and they say they've got this ringing or buzzing noises in your ear, and then you start to take notice, say, hey, you know what, I have that, but what is that? Not to alarm anybody, it's usually one of the first signs of an ear condition. If you produce a lot of wax, it could be a temporary side effect of having your ears impacted fully with wax. If you are 55 and older, it might be one of the first signs that you have some hearing loss. If you have a noisy occupation or wherever in the military, chances are you have ringing, buzzing. Sometimes it can sound like locusts in your ear. And a lot of time patients ask, how do you manage that? Well, the first thing that we do is we recommend that you get a hearing test, because it is typically the first sign of some hearing loss, hearing damage in the ears, whether it's from noise or from aging or something else. So if you have any questions, if you've been diagnosed with a hearing loss, you don't have hearing aids, and you're looking for ways to manage the ringing, the buzzing, the locusts, call our office. We can certainly sit down and go over some strategies with you. If you are just curious on where your hearing status is before the onset of any tinnitus, we can certainly get a baseline exam, and then we can just keep comparing every year if it gets worse, or if you should expect to get some tinnitus. There is some cases where people that have hearing loss, they never get it. So it's just random. It usually is the first sign of some hearing loss, and when you do notice it, we do recommend that you come in and you get tested, and then we can talk about ways to manage it. It's a very easy thing to manage. If you talk to a lot of people and ask them specifically, you'll find that majority of patients have ringing or buzzing or some sort of, whooshing or ocean wave kind of sound in their ears. For me, I have it. I notice it at night. I take my hearing aids out and it's been a long day, the kids have been in my face or whatever, and I will get a high pitch ringing, and I usually notice it when I'm tired, and that's pretty typical. I put my hearing aids in, then I don't notice it as much. But usually if you're well rested, you're getting your sleep, you reduce some of your stressors, those are some of the things that can manage it. If those are not helping, then we certainly can go over other things such as medications and lifestyle, and we can talk about ways we can make modifications there to manage it. So Dr. Mandy, if you have any questions, give us a call, 605-306-3050.
We are here to help. If you want to chat with Dr. Mandy, go to SiouxFallsAudiologyAssociates.com.